Okay, inshallah, I think we'll begin. Bismillah. الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله وحده لا شريك له ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. السلام عليكم ورحمة الله وبركاته. And welcome to our webinar, a very special webinar on end-of-life care, palliative care in the Islamic perspective. So, alhamdulillah, today we have some very special guests. As a generic overview of our guests, as panelists, we have people who are recognized in the field of end-of-life care from an academic perspective, from the fiqh perspective, from the chaplaincy perspective, and also we have medical specialists in the area of end-of-life care, palliative care. So alhamdulillah, inshallah, the hope is that we will have a very fruitful discourse and a discussion. So just to start off, I'll just give you the outline of today. So we will have approximately 45 minutes where we will have our own discussion amongst the panelists about some very, very important points, things that I'm sure that a lot of you want to know regarding end-of-life care and palliative care. And then the next 45 minutes will be a Q&A. So this will be the opportunity for you all to ask your own personalized questions to any of our panelists. So please do use Q&A. And if any of you want to come online and ask your questions, then inshallah we'll give you the opportunity to do that as well. So you can come online and hopefully inshallah we will open up your microphone so you can actually speak to the panelists and fire away with your questions. So let me first introduce our panelists. First and foremost, if I can ask our panelists to open up their webcam so that we can see you, inshallah. So we'll begin with Sheikh Yunus Dudwala. A lot of you are very familiar with him. He's a regular instructor on our courses. So Sheikh Yunus Dudwala, in essence, is somebody who is leading the Muslim healthcare chaplaincy in the UK. He's the head of the chaplaincy and bereavement services to Barts Health NHS Trust. And he's located in one of the highest Muslim populations in the UK. So he's very accustomed to a long number of years of service in this particular area, somebody who leads on this and deals with frontline and face-to-face contacts with patients, relatives, and clinicians, especially in relation to end-of-life care. The second panelist we have is Dr. Muhammad Ghali, who is a professor of Islam and biomedical ethics, an academic at the Research Center for Islamic Legislation and Ethics, which is well known for a number of different areas around ethics. Dr. Ghali's main specialization is actually intersection of Islamic ethics and biomedical sciences. He did a very recent paper, a kind of a policy document for a lot of individuals and organizations regarding end-of-life care and palliative care, which is really well received. So inshallah, we'll have the opportunity to discuss that with him as well. Our third guest is Dr. Rami Salah. So Dr. Rami Salah is somebody from San Francisco Bay, and he's somebody who's just finished his residency in internal medicine at UCLA, and he's finished his fellowship at UCSF in hospice and palliative care. So he's somebody who's a specialist in palliative care or end-of-life care, and inshallah we will get a thorough perspective from the clinician perspective about end-of-life care from him, and also somebody who has a serious interest in bioethics, so he'll have a good understanding of how ethics relates to some of these dilemmas that we have. And then finally, a special guest, just last minute, we have Sheikh Dr. Tariq ibn Talal ibn Muhsin Anqawi. And he is somebody who is the assistant professor in the Department of Sharia at the College of Sharia in Al University. And he holds a doctorate in the area of Islamic bioethics. His particular thesis is mainly focused around life support treatments, rulings. And I was just recently having a browse through his PhD, and alhamdulillah, very comprehensive, inshallah. So we'll get a lot of insight in terms of a lot of the fiqh related to some of this, hopefully from him as well. So inshallah, without further ado, because there's a lot to ask, I'm going to first call on our panelists to open up their webcam, inshallah. And I will first start off by getting a discourse going. Let's talk about some really important things when we talk about end-of-life care or palliative care. You know, what kind of things are really important here. So first of all, let me start by definitions, because sometimes we get stuck with definitions. We don't really always grasp what it means by end-of-life care or palliative care. So let me start with Dr. Rami Salah. So let's talk about, for example, end-of-life care and palliative care. What does that mean? What does it mean by end-of-life care? What does it mean by palliative care? Do they mean the same thing, or are they quite different? Do we deal with these two things quite differently?
Bismillah, walhamdulillah, wa salatu wa salam ala rasulillah. Palliative care is, I think, one of the most misunderstood, misconstrued fields in medicine. And it's always, you know, apart from providing palliative care to patients and families in need, I have the task of clearing up those misconceptions, because palliative care in a strict sense isn't just end-of-life care. There are many ways to define palliative care. The way I like to define it to patients in a quick kind of way is that it's a specialty in medicine that focuses on improving quality of life for patients and families when they're going through serious illness. Really, the three buckets are symptom management, spiritual, emotional, and psychosocial support, and lastly, goals of care, advanced care planning. It's hard to define because I think every other specialty in medicine, almost every other specialty in medicine, requires a step in, right? Cardiologists take a step in and look at the heart, and nephrologists take a step in and look at the kidneys. Whereas palliative care clinicians, we take a step back and we look at what's behind the patient, their experiences with illness, ahead of the patient, their hopes and worries for the future, who's around the patient in terms of their support system, the ground that they're standing on, in terms of their home situation or finances, and of course, what's above the situation, their relationship with spirituality, faith, God, etc.
So it's Rami, just to get more specific, if a lay person was to ask you that somebody's offered my father palliative care, how would you explain that in very, very clear terms and very brief words? How would you explain what that means now? Or how would you explain to your patients, for example?
That it's an extra and essential layer of support for you and your loved ones as you're going through this journey. It is not strictly end-of-life care the way hospice is. Yeah. Okay,
right. I'm just going to move on, inshallah, jazakallah khair, to Dr. Ghali. Dr. Rami has basically given us a general account of what that would mean and how he may explain it to patients. Now, from a perspective of, you know, what's the general, what we're getting from Muslims generally, amongst general patients and relatives, what's their understanding of palliative care? How are they perceiving it? Is it something that they're accepting? Is it something that they're thinking this is not something that Islam advocates or is contrary to Islamic values? What kind of feedback are you getting? What kind of information are you relating on this?
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Thanks a lot for the kind invitation and for having me among this important group of colleagues and friends. I just would like to start, you said something very important about the definitions. So in order to be able to answer the question how Muslims perceive or should perceive the palliative care, I would like to say something about the issue of the definitions. Two main issues, and Dr. Rami can correct if there are misconceptions in this regard, because they are very important, and I think they frame the discussions, not only within the Islamic tradition, but within the field of bioethics in general. The first one is the so-called medicalization of the dying process. We have a literature in the especially in the 1970s, speaking about the limits of medicine, and that we are moving ahead and going too far with what medicine can do. Of course, this happened with the introduction of life support machines, life-sustaining treatments, etc., and to use them in every single possible case, etc. Some physicians even were critical about this, but mainly social scientists, ethicists, bioethicists, etc. So we had a question about where medicine, we should say to medicine, here you stop. There is no cure meant for this disease, and we have to give up. So this is an important question. So in a specific moment, it seems palliative care should come in because curative medicine cannot do anything. So we cannot cure the underlying disease, and that's why we only palliate, make it easy, improve the quality of life, as he mentioned. So number one, recognizing the limits of medicine, and that there are some cases in which we cannot treat the disease. We can only deal with the symptoms and minimize them as much as possible. The second thing is to differentiate. We have the broad term in the Islamic tradition, we call it tadawi, treatments. And we have a genre of literature called 𝐀𝐜𝐚𝐿 tadawi, but usually we miss the important nuances between curative medicine on one hand, which we have always expected from medicine. I go to the hospital because I have a health condition and I want to get out of the hospital without this health condition, going back to my normal life. Moving from this traditional perception of what care is and what medicine is, curative medicine, into palliative medicine, that we as patients, as physicians, need to realize that there are limits, and sometimes we have to stop. This move from the curative medicine to palliative medicine would sometimes necessitate, and here comes the ethical questions and dilemmas, would necessitate stopping the curative medicine, because this curative medicine is not the right place here, and now we have to go to the palliative medicine. So what makes things strange in the mindset of some patients, families, ethicists, religious scholars, and others, is that I go to the hospital and you tell me we have to stop this and stop the, so why I'm here. So we need to understand the historical context, that there was critique about expecting too much from medicine. We have to realize that there are limits, and there are books with this title, Limits of Medicine and the Job of the Future Physician, etc. The second, we need to differentiate between what is curative medicine and what is palliative medicine. In curative medicine, I go with a health condition and I try to treat this. Sometimes it works, sometimes it not, but the aim, the goal, is that we treat the underlying health condition. In palliative care, the aim, the main goal, is that we put the symptoms under control. We try to minimize them in order to improve the quality of life. And sometimes we have to forgo and stop the curative medicine in order to give space for the palliative medicine. So I think we need to keep this in mind, and I hope it was right.
It quite well. So in essence, we're looking at this sort of transition from a curative process where we're looking at medication or using interventions that cure people from their illnesses. And that goes on to another sort of dilemma where this is the limit of the cure. And now we're going into conservative treatment where we're looking at symptomatology, or symptoms are curing symptoms and dealing with patients' symptoms and treating them. So Dr. Sheikh Yunus Dudwala, if I can bring you on board, for somebody who's clearly involved in this on the ground, how is that received by Muslim patients and relatives when the doctors or the clinicians tell the patients, okay, we're in a situation now, we can no longer cure this patient, they have a particular cancer, and the only way to move forward now is to use conservative means of palliative care. What kind of perceptions do you get from patients' relatives? How do they perceive that? Is that something that they can understand, they can comprehend?
Bismillah ar-Rahman ar-Rahim. Jazakallah khair again to Balagh for having me on the panel, and Jazakallah to Dr. Rami and Dr. Muhammad Ghali for that introduction. I think it's really important to understand what is palliative care and moving from curative to palliative. And I think this is where, from my experience dealing with families, we find a lot of resistance from families because of their understanding of what Allah and the Prophet ﷺ has said in terms of keeping someone alive. So majority of the individuals, families I meet believe that you have to keep someone alive and you have to keep on trying and trying and trying until the last breath. Whereas from a fiqh perspective, and Dr. Muhammad Ghali and Dr. Tariq will mention going in the next hour, that from a fiqh perspective, that is not the case. Islam does not say that you keep on trying, even though there might not be any benefit in a particular cure or in a particular treatment. And in fact, the fiqh argues that it's not even farad for you to take medicine if that is your choice, right? So unfortunately, we do have lots of different families who will resist palliative care, and they will say, well, they are trying to kill my father, they are trying to kill my mother, they've given up on my dad, they've given up on my mum.
So these are personal experiences that you've had of families.
It's weekly. Yeah. Every week I have at least one case like
really?
That. Yeah, absolutely. Because it is what it is. Because that's the layperson Muslim's understanding is you continue and you continue and you continue. And there's sometimes you feel that there's no dignity for the individual. There's no respect for that particular patient. They're not dying a dignified death. Whereas Islam allows a dignified natural death to happen in its own time. And I think the other misconception is that you are then hastening death. So you are hastening death by allowing palliative care or by allowing some kind of intervention through morphine or pain relief, etc. And they believe that it is hastening death. So there are these misconceptions out there.
Just to add to that, because that's a very important point, because we've got a quite large audience here. Our audience consists of mainly medical professionals. We've got some academics in our audience. We've got some people involved in policy. And also we have patients and relatives who are our audience. So is the issue here not understanding why the clinicians want to continue treating them? And do they feel that when it means palliative, it means that they need to prepare for death? Because sometimes is that kind of perception that you're getting from them, that now the doctors are saying, right, we've given up on you, we're not going to concern ourselves with you now, we've got other things to deal with, so here, look, take a couple of medication for your pain, and let's ensure that you have a good death. Is that the kind of perception that we're getting from patients and relatives? Yeah,
it is. I mean, you see, palliative care could be from 1 day to 12 months in reality, in terms of somebody could be treated for palliatively for around 12 months. However, what we find is that majority of the families will think that they've given up and they are now just waiting for my dad to die or my mum to die or for me to die. And I think they're not thinking about what is the reason behind their decision making, and is there any treatment possible for that particular individual, and have they given up, or is it because of their particular condition? And I think we need to give that understanding and educate people around why people make those decisions.
Some of the Sheikh Yunus, some of the issues sometimes that tend to arise here, where we've got usually palliative care or general treatments being provided by clinicians, and clinicians active treatments that I'm talking about here. And when clinician says, look, I'm afraid there's not much else we can do, we need to now stop actively treating this patient, then Muslim patients usually would turn to their Islamic tradition, and cases like that, they would then address this and say, look, our Islam tells us it's an obligation for us to continue treatment. We cannot give up on our family member. I'm just going to go to Dr. Tariq Anqawi. So Dr. Tariq Anqawi, if you can give us a bit of an insight maybe on our obligations as Muslims to take life-saving treatments. Make it quite brief, and inshallah, just give us a bit of an idea. How would you address this to, let's say, for example, families that are asking you regarding the Islamic stance on the obligations of these kind of treatments that are the limit of treatment, let's say?
I think I should give a short comment first about something which is there in the background, and we need to solve it before we go to the question of when the treatment is obligated. This question is a very profound question. Do we have to save life at all costs? And more profound is to ask, does life have a value in itself, or does it get its value from the benefits, or from the materialistic benefits, or from even the spiritual benefits, or whatever? So in the end, it has a value, and you can evaluate this value. You can say sometimes it doesn't worth it, or it does worth it. I think that's at the core of the debate, and I try to go deep to this before detailing measurements or detailing a criterion about when the treatment is obligated or not. I think we have a problem, a big problem here. In Islam, I don't see anything that makes life make us able to evaluate life. It's precious. It should be saved. But should it be saved by any mean? No, that's not the answer. So then what is the criteria we have, or what is the reason that we can stop treatment, we can withhold treatment sometimes? It's a different concept. We go, and this is, I'm getting now to your question. We look at actually it's multifactorial thing, but I can reduce it for simplicity to two major factors. First thing is we look at the patient need. The patient is obligated to seek treatment only if he was in urgent danger of dying or becoming severely harmed if left untreated. And the second factor is the treatment effect. We should look at the treatment effect, and in other words, the successfulness of this treatment. Sometimes it has a usual successfulness. It will be most likely successful in usual, in habitual way. Sometimes it's the opposite. So going from this differentiation, we can then give the answer for this question. And here there's a profound idea about this. It's not just an apparent answer, because if we look back to the principles of this involved in this issue, we can find that Sharia makes life-saving a very big goal. It's one of the 5 necessities of Islam, but in the same time, it promotes making ease, or making things easier, lifting hardship, I can say in another word. So by combining these two principles, by trying to activate both of them, by making them interact together, we can get the answer for the question, not by omitting the preciousness of life, or by making life a thing that we can evaluate.
Dr. Anqawi,
yes.
I mean, I think you really hit it really well there. It's really clear what you're saying there. And just for the benefit of the audience, I really appreciate, because we've got people here who are very experienced and very knowledgeable in their areas. It's very difficult for us to stop them and move on to the next person, but we've got very limited time. So inshallah, and I really want to give the audience some opportunity as well. So, you know, but we'll hear a lot from all of you, inshallah.
This is the base of it. I'm going to detail it later.
The two things that you mentioned, which are really, really important, and I think it's really important to emphasize them. There's something about the seriousness of the illness. So in terms of, is the illness life-threatening? How sure are we that the illness is life-threatening? And the other component, which is very important, is, okay, so we have a form of treatment that can cure that illness. How sure are we, how certain are we that that cure will actually cure this particular individual? So taking an intersection of both those two things, we can then decide on the level of obligation. So clearly, if it's really life-threatening and we're really certain about that, and if the treatment clearly is something which is going to be very effective, then you could say that this would be an obligation. So as a principle, that's quite thorough.
Yeah,
I'm going to now move on, and we'll come back to these discussions because we're going to talk about withdrawing and withholding treatment. I'm going to go back to Dr. Rami again, and I want to sort of a clinician perspective. Sometimes we hear a lot about patients and relatives and how they're perceiving things, but we don't get enough in terms of what about doctors and physicians, because they are real people. They get this, you know, especially somebody like yourself who works in the palliative care environment and end of life care. You must get this a lot. So from your perspective, I just want to get your own account, or maybe some stories where Muslim doctors have been unsure about certain ethical situations at end of life care, and how did they deal with it? You know, where did they go to get answers? It's really important for us to know as patients, patients' relatives, you know, what doctors think in situations like Muslim doctors in particular, I'm talking about.
Yeah. There have been very difficult cases, and especially as a Muslim physician practicing in the West, where things have become legal and deemed ethical on a societal level, it does pull at you. Two things come to mind that I've been involved in patient cases. I've had patients who had inquired about this and even followed through with it, are the medical aid in dying, which is legal in 7 states in DC here in the United States, and as well as countries in Europe, where a physician may prescribe a lethal dose of medications for a patient to end their own lives. And then also the voluntary cessation of eating and drinking to cause death, withdrawing artificial nutrition in a case to cause death. And those are difficult cases, and one that as a Muslim, I have a difficult time with. And in terms of where to find support or where to find answers, if you don't take anything away from what I have to say today, it's that Al-Balagh has become such a vital resource. I've taken courses at Al-Balagh. I've learned at the virtual feet of some of the best teachers, and to have something so accessible, I'm sure our predecessors could only wish for something like this. And then the other thing, because it is from an emotional and spiritual place, and this is why I love palliative care so much, because it's an interdisciplinary or multidisciplinary approach to care. So just like doctors have a seat at the table, so do nurses and social workers, and of course, people like Sheikh Yunus, you know, chaplains. And I have colleagues that are on the call in chaplaincy, Muslim chaplains, that I'm able to decompress, to debrief around these cases and to make sense of them. So both on the academic side and then also on a spiritual and emotional side, trying to make sense of these cases. Yes.
Okay, so I'm going to Dr. Ghali. Dr. Ghali, now let's go on to the Muslim jurists. You know, Muslim jurists are really taxed on some very complex and complicated issues. So, you know, and they have to deal with this because they're the main people that we resort to when we want to know the Sharia stance to some of these issues. And I know you've done quite a bit of work around this. So when Muslim jurists, when they address some of these issues, like for example, withdrawing treatment, we'll talk about definitions again in a short while, but more so, you know, some like withdrawing life-saving treatment and giving advice regarding that. Do you find that the current fatwa and the qarar that are out there and the kind of resolution committees that are giving some of these levels of advice from the Sharia perspective, do you think that that satisfies clinicians like Dr. Rami in terms of, is it enough information for them? Do you think there's gaps in there? Do you think that it could be done differently?
Thank you so much. I think in the Islamic discourse on palliative care and life-sustaining treatments and similar like-minded bioethical issues, which are complex and multidimensional, we need to differentiate in the discourse between individual ijtihad or individual fatwas issued by individual single Muslim scholars and the collective ijtihad al-jama'i, or the resolutions. And when it comes to the collective ijtihad, we don't have only religious scholars on the table. So we have the religious scholars, and we have also the biomedical scientists, and sometimes we have other specialists, but mainly these are the two main issues. And what we know from the discussions of these councils and fiqh academies is that the questions were posed by physicians. people like Dr. Muhammad Ali Al-Bar, Dr. Hassan Shamsi Basha, and others, they have problems on their work floor, and they go to, they raise these issues for these councils, and they start discussing them. What we see in the collective reasoning or the collective discussions, we have more or less agreement among the physicians. The physicians think that at certain point, we have to know that we have limits and we have to stop what we call aggressive treatment, stuff like specific life-sustaining treatments, etc. And they don't want to feel guilty if they did that. So what does Islam say about this? And then we start the discussions. These fatwas or resolutions have also impacted the individual discourse, because some of these scholars, they also have their own individual position and their own individual fatwas. So there is more or less a kind of going forth and back between these two. What I can say about this, we have two main positions. Two main positions. One position saying that we have to do everything possible as long as this thing will keep the person alive. So if the life support machines keep the person alive, and if we took them off, the person will die, most likely, probably, then we have to keep it. And we can talk later about the reason why each part for the sake of time. But there is anyhow one position in this regard, that we cannot stop anything that can keep the person alive. These are mainly the individual Muslim religious scholars. I'm not aware of physicians who participated in the collective ijtihad saying this, but this is an opinion with reasoning coming from it. The other opinion, which is quite supported by the physicians, by different individuals, and by Islamic fiqh academies, including the Islamic fiqh academy in Mecca, saying that there are instances in which we can stop these life-sustaining treatments using DNR policies and stuff like this. And they have conditions. It's not unconditional permissibility. There is conditional permissibility. One of these conditional permissibilities is that we must have a group of physicians who will decide about this issue, and not only one. And some also discuss that we must have an interdisciplinary team from these physicians, not only from one. Some would say none of them should be from, for instance, the organ transplantation team who are waiting for harvesting the organs, etc., etc. But also some of the conditions speak about the irreversibility of the condition of the patients, that we have reached the point that there is no way back. So the physicians should decide the deterioration of the health condition of the patient is not specific to a specific treatment, a specific disease that we can treat. So it's not only, for instance, the kidney failure or the heart failure, or that there is a problem in the lung. It's the whole body is deteriorating. Whatever you try to fix from here, it's from there. So we have a clear indication that this person reached the phase of what we call in Arabic, istadbar al-hayata wastaqbal al-maut. He gave his back to life and his face to death. These are conditions. So I'm not aware of any religious scholar who said that we can always do it.
So
there must be conditions.
Dr. Ghali, there is dissent that does exist in some of these. You mentioned the collective ijtihad, where you have a number of scholars sitting with physicians and various other people that are involved in that sort of a process, and then you have also individual muftis and scholars of Sharia who come to their own conclusions. So there is, and each one probably has their own influence group. So they influence different groups of people.
But there is one thing upon which more or less we have an agreement.
Yes.
Dr. Tariq can comment on this also, that when we have a case of brain death, so the scholars who recognize brain death as death, and the scholars who do not recognized brain
Yes.
deafness, both agree
And this
that
is
in
very
such
important.
case,
Yeah.
we can stop, for instance, switch off life support treatment.
Dr. Ghali, we're going to come back to this because this is a separate, really big discussion. So we'll
Okay.
come back to this, inshallah. Sheikh Yunus, just going back to you. Dissent amongst fuqaha. Right. So this is sometimes something that happens, though one is dominant. So in other words, there are certain futile conditions whereby we can now withdraw life-saving treatment according to majority of the fuqaha who are out there. A minority say, you can't, you have to go to the extreme. How does this play out on the ground? Can you give us some stories about how this can make your job very, very difficult? Because I know that you've gone through a lot of these kind of cases.
So, we've got lots of cases. There's one that ended up in court in the UK as well. So it's well known in this country where this child was had some brain injury, but it wasn't brain death. But the brain injury was quite severe in the sense that the doctors felt that it's time to let that child go, but the family insisted that the child should remain and should be kept alive. I think
it's very sensitive because it's a child, isn't it?
It was a child.
Children could be even more.
And then who has the decision in this country as well? That's the other thing. When the child can't make their own decision, so it's the parent who makes the decision, and that ended up in court. And the family won their court hearing, and the judge allowed, and they wanted to take the child to a different country for treatment if there was no one willing to keep this child alive in this country. And this is where they won in the challenge. So that was a really, really difficult case because we had scholars within our community in the UK. We discussed this quite openly. I got in touch with yourself, Mufti Zubair Butt, and others, and we discussed this case as much as we could and tried to understand it from a fiqh perspective and tried to come to a consensus opinion. But there were other scholars who had different opinions. And those opinions were put forward in the court case and as the Islamic opinion. Now, at the end of the day, the child remained alive, and that is what the court decided. And it's not for us as scholars or chaplains to make decisions on these matters. All we can do is advise that this is permissible and this is not permissible, or this is allowed and this is not allowed.
So Sheikh Yunus, from your personal perspective, I'm really interested in this. I'm sure many people are, and we've got quite a lot of chaplains who are on this webinar at the moment. What kind of things did you say to the family? How did you bring this to the family? I mean, did you take?
So
how did you explain it to them?
Yeah, so I remember when I first got the call about this child. It was around Eid after Ramadan, as far as I remember. It was one of the Eids, and it was a friend who told me that this family is in hospital and they need some support because the doctors are saying they want to switch off. So I went to the family. I spoke to the mother. I spoke to the father, and for me, I try and keep it as open as possible. I try and say, look, in Islam, these are the options there, right? So I don't dictate my opinion, and I don't have an opinion. It's not for me to dictate any opinion. This is what the scholars say. This is what is allowed. This is what is not allowed, etc. And then I guided them to some of the papers that have been written, the academic papers. For example, Dr. Fadela's paper is really, really good. Dr. Ghali has written extensively on these issues. And I say, have a read of this, and then we'll speak later on. So I give them the tools for them to understand what is allowed in Islam and what is not allowed, and then let them make their own decisions.
Okay. So did you talk about maybe the treatment being ineffective, or did you use those kind of terms like futile or?
Yeah, I mean, I would repeat the words of the doctors. So I'm not an expert in that particular medical area. And I would mention to the doctor, well, if the doctors are saying that the treatment is ineffective, then I would repeat the same words, because that's what I can go upon. I can't go on any other evidence, medical expertise. And it's 2 or 3 consultants who are dealing with this case. So I'm looking at the case from a medical perspective and relying on the experts who are there at that particular time. And it's not only one consultant, it's 2 or 3 consultants who are making that decision.
So I'm going to move on to Sheikh Tariq. Now, we've got a bit of a dilemma here. As clinicians, as chaplains, as even other ulama who have to deal with this when patients come to them. And that is about the fatwa and the wordings that they use. I'm not going to express it in Arabic, but I'll give some translations and even express some of the wordings that are used in English. So when treatment is futile or useless, IOMS, that's what they said. When sickness gets us out of hand and recovery happens to be tied to a miracle, Sheikh Qaradawi, or physicians have lost hope for life, IFA in India, or no longer hoped that such a person will be cured, that's 𝐁𝐚𝐥𝐚𝐝, or there's no chance of survival. So these are the kind of terminologies or kind of wordings that you'll find in some of these fatwa regarding when it's right to now withdraw life-supporting treatment. So let's just sum it up. Like futile treatment or treatment that has no benefit whatsoever. How does the Sharia look at that? How can we articulate this that might be something that clinicians can work with? Because at the moment, there's a lot of confusion about this. When is treatment considered as futile? How do we look at this? Sheikh Tariq.
In my opinion, the first thing we should do in terms of Sharia, as you said, is to clarify things and to make sure we are understanding these terms and we are using them in the right way. So when you say futile, for example, some of the scholars will, it's in Arabic, they say no jadwa, no benefit, or not appropriate sometimes. So some of them will think that this will not save life. So they will give a fatwa that it's okay to withhold treatment, for example. But when you discuss with them that this term have 2 meanings, or it could have a quantitative meaning, meaning no success at all, or it could have a qualitative meaning that it will not succeed to restore a meaningful life, quote unquote. And what is meaningful? This draws us to the talk about what is life and what are the values of the person. So I had an experience to explain to the Islamic Academy of Mecca, مجمع الفقه الإسلامي التابع للرابطة in Mecca. They issued a decision that life support could be withdrawn if it's not beneficial for the patient, if it will not cure the patient. So I said to them, this means that that the physicians will understand that they can stop it even if the person will die. So they were shocked. Some of them, I talked personally with some of them, they were shocked. They said, we have no idea about this differentiation between the 2 terms. So guess what? They issued another decision, and it was posted. It was actually published in their original paper, in their original journal. Sorry, and the one in the bad thing about this, the one in the website, they kept it. So there are 2 contradictory decisions here, and the first decision went everywhere. It was translated to English, but they think that they did the right thing when they just changed it in the journal. So it's painful. For me, it was very painful experience. I think most people don't know about this. So we have to be very careful with the terminologies. We have a problem. Islamic scholars are not understanding medical terminology. And I have also a conversation. I'm a little bit anxious about repeating words from doctors, because also in this instance, we might involve some values, some philosophical ideas, and then name them medical terminologies or medical decisions, while in the reality, they're not mere medical. So this is the first thing. And as you said, some of them, they use the futile. Some of them use the survival. Survival is a good term, is a clear term. Nobody will have doubts about it. But when you say futile, when you say meaningful recovery, and you start to use such terms, then you'll start you will need to ask, what do you mean by that, before you can issue a fatwa about it.
Okay, sorry. So I think so there's some really important things there in terms of, we're going to go back to Dr. Ghali regarding this, looking sort of, see, there's something about the qualitative and the quantitative aspects of end of life and how we are measuring it. So there's a philosophy about how we look at that. So we've got what we call the secular understanding of that, but there is also surely an Islamic traditional understanding of that. We'll come to that in a short while. Before I do that, I'm just going to go to Dr. Rami again and ask this question regarding how easy it is for doctors to do this. So at the end of the day, the ulama can make a decision. Families and relatives can rely on physicians and clinicians to advise them on this in terms of the sort of clinical perspective. How do Muslim physicians and clinicians deal with this? So this is about now deciding that this treatment, I'm going to use the term futile, but we'll discuss that in more detail, is now futile, and the life support machine should go off, for example. Dr. Rami, how do Muslim physicians deal with that? Now that's quite a, who turns on the switch, who turns off the switch? And whenever you talk to lay people, they usually say, oh no, the switch is going to be turned off. This is a cause of euthanasia. So how do Muslim physicians and clinicians deal with this?
And I'll speak on my own behalf with this. I think it goes to another question that I heard some of the other panelists touch on. And I have a question for the group, for all the attendees. What equates as treatment? I think we put the treatment, whether it's curative or aggressive measures at the end of life, we put those treatments on a pedestal. And palliative treatments, to ease suffering, to improve quality of life, I believe that deserves a seat at the table. And I'm just going to highlight one quick medical study to scientifically prove this or help this. There was a landmark study back in 2010 in the New England Journal of Medicine, randomizing metastatic non-small cell lung cancer. And in 2010, on the eve of immunotherapy, these patients would not live past a year. And what they found is they randomized them to palliative care to go alongside with curative treatment or just standard of care. And the palliative care arm they had better scores with anxiety and depression, better scores with quality of life. That's a given. You had a dedicated team to address those issues. But what they did see at the end, that despite not receiving aggressive treatments at the end of life, less likely to be in the ICU, less likely to have life support, less likely to have chemotherapy at the end of their lives, they actually lived longer. The palliative arm without aggressive measures lived 3 months longer than the standard of care arm. And 3 months doesn't sound like a lot, but for these patients at that time, that's a lifetime. So it gets really muddy in terms of treatment. And so when I, as a doctor, am called to provide palliative treatments, whether it's opioids, whether it's removing certain burdensome treatments, I have an easier time with it, quite frankly, because I don't put the treatment front and center. I treat the patient and I put them front and center.
Okay, so that's an interesting perspective, because I haven't given my perspective. As a general practitioner, I deal with a lot of elderly in our community, and we also have patients, even young individuals who are dying from cancer, and they are end of life care. And when you approach a palliative perspective to those patients, there's a greater sense of comfort that they go through because of their symptom relief. Also having that regular visit from their doctor, having that regular visit from people they are very familiar with in terms of clinicians and so forth, it really brings that sort of end of life care to a comfortable sort of setting for a lot of them. But another thing that tends to happen is we have patients who are not under palliative care, and that does exist even in certain communities. So what will end up happening is they'll have, for example, end stage kidney failure. So it's not that they've got cancer, they've got kidney failure. So they are frail, they're at home, they're very vulnerable, and their prognosis probably is not different to somebody who's end of life care with cancer. But yet they're not put onto the palliative care register, so they don't have that level of care. And you know, you do hear stories about some of them, how they suffered, you know, before they died. Whereas if they were on the palliative register and they were undergoing palliative care, then their care would have been quite different. And it's quite an important sort of thing to reflect on. I'm going to go to Sheikh Yunus. We're going to go into some really technical stuff here. And before we do that, I'm going to allow our audience to come in as well. So if anybody wants to ask any questions, please ask on Q&A. Put your questions on Q&A. And inshallah, just give us a few minutes and we'll answer one or two questions. I'm going to go to Dr. Ghali as well. He's going to give us a bit of a response to one of the questions as well. What I would like you to do is, if you want to come online, ask your questions, that'll be good. We're quite happy for you to do that, if you can come online, and we will allow you to ask questions as well. Now, Sheikh Yunus, we got a clinician's perspective. What about families' perspective? How easy for families to withdraw or withhold life-saving treatment? Before I go into the details, let me just give you an example of withdrawing and withholding life-saving treatment. So withholding life-saving treatment is, for example, where you are, somebody is on artificial nutrition and fluids and hydration. So what you've done is you've decided to now withhold it. You're not going to continue with this, okay? And that person's end of life. And withdrawing would be, for example, they're on a life support ventilator, and you've decided to now withdraw the life support ventilator. So this is for, just to clarify for our audience. So in that perspective, what kind of responses do you get from families? How does this work for families when those kind of decisions are made? How do families tend to respond to that?
So we get both types of families. Some who will agree to withhold and withdraw depending on the condition of the patient. And we get resistance as well. Okay, and I can give you cases where, I mean, it just depends on the confidence they have with the chaplain or the imam, and the religious advice that they're taking from the community or the imam within their community, or just how they feel about their father or mother or loved one's condition. And I think it will depend on that. There are extreme cases that we've found. I was just going through some notes where one of the doctors, we were at a Cambridge seminar, and there's a consultant there who I know quite well, is a non-Muslim consultant who I've done some seminars with previously, Dr. Philip Lodge. And he brought a case to the table where he said that, you know, there was this really poorly person who was 69-year-old, sudden collapse at home. Family started CPR, and then he came to the hospital, intubated by the paramedics, came into ITU and developed kidney impairment and signs of ventilator-associated pneumonia, and they were not happy. So I think they discussed whether to put on a DNA or not, DNR or not, right? So I think they had that discussion. And then when he deteriorated himself and he died on the ventilator, the family started CPR. And they already had this discussion that there will be no CPR.
Okay.
And you know, this is an extreme case, because the distress that some families go through when this happens.
Yes.
So then they called an imam in Pakistan on video call. And they said, you know, should we carry on? And he said, yes. So they carried on CPR. And then the hospital had to call they didn't have a Muslim chaplain. They called the local mosque. Somebody came from the local mosque. And then that's when, or else they kept on taking turns until that person, until the person came from the mosque and said, you know, you've done as much as you can, and please, you need to let go. And that's the extreme. So we do get both, you know, with it depends on the confidence that the person has in the Islamic advice that they receive, and also the condition of the patient as well. I think if they feel that their father has had, or their mother or the loved one has had lots of illnesses for some time, and they feel that now it's time to let go, it might be easier for them to let go, rather than if it's a short illness, then sometimes it's difficult for them to let go.
Okay, alhamdulillah. So yeah, so you can just see how this is a question of acceptance for relatives, isn't it? So how do families accept those kind of decisions? And some families would react to that in a way where they would actually take on their response is to take over and actually start, even like the example you've given, they start resuscitating themselves.
But also, Dr. Lafaqat, I mean, we've got scholars in this country as well who feel that DNA CPR is a form of euthanasia, and you can't allow somebody to do a DNR sign on a DNR. So, I mean, that's extreme. You know, we've got individuals in this country who are saying that you can't even sign a DNR order if for a patient whose condition is such that it's not going to benefit them at all. And that's what we're grappling with in this country. I think the majority consensus is there in terms of DNR, but there are some individuals who are giving advice to families that no, you can't sign a DNR. You've got to have them. If the person goes into arrest, then you've got to do a CPR, etc.
It's interesting how I've even come across certain families or patients who differentiate, and they recognize this idea that if it's CPR, then no matter what, you must continue. Everyone should have CPR. But if it's about taking off life support, let's say on a patient who's brain dead, then that's acceptable. It seems quite strange because, and the interesting thing there is with withholding, CPR is withholding life-saving measures or intervention. So that's withholding. And then you have withdrawing, so that's where life support is withdrawn. So Dr. Ghali, I'm going to ask you, then I'm going to start opening up to questions from the audience. And I want you to be really clear about this, have the ulama, because there is a lot of discourse in this, in the Western medical ethics or bioethics, about differentiating between withdrawing and withholding life-saving treatment. Has this been a sense of discourse that we find amongst Muslim scholars and within the arena of Muslim discourse?
Thank you so much. Let me just say one quick thing about the disagreement among the scholars about this and how to handle this in a hospital setting. Most of the bioethical issues are new ones. So to expect that we will have consensus among everything, I think it's very far-fetched and it can be very frustrating. There will be disagreement. We don't have a human being with binding religious authority after the death of Prophet Muhammad sallallahu alaihi wasallam. There is ijtihad and there must be freedom, and people should be able to express their opinions. And individual Muslims should be able to choose. Okay, in the hospital setting, this is quite problematic because as a doctor, what should I do, etc. I always say to my colleagues here in Qatar, a very practical solution. When the patient is admitted in the palliative care unit, let's say, have a discussion with the family, ask only one person to speak with you in the name of the family, and prepare well for the discussions. And once you agree with this person, then it's finished. Otherwise, it will be chaotic. The disagreement of opinions within the Islamic tradition should be a source of mercy, not a source of distress and troubles for the people doing their work. So this is just a simple, practical
very important, very important statement.
But let's go now to withdrawing and withholding. In the discussions I have said so far, whether in the individual or in the collective, I didn't see substantial disagreements, morally speaking, between the two. They usually speak about rafa, أجهزة الإنعاش, foregoing, stopping, which is more likely to be the withdrawing than withholding. In my readings of the classical discussions, you can say sometimes that we can make a differentiation, but this is very technical and we need to go into the madhahib, etc. So it can be confusing for our audience. Yes. But as far as I can see, in what I have read so far, they don't make significant differences between this. They do make differences between this type, which we may call sometimes passive euthanasia, and you will have disagreements, and the active that we will give someone an injection in order to purposefully and intentionally terminate someone's life, which is by consensus prohibited. So there is no disagreement here. The active euthanasia, even with the consent of the patient, the physician, even if it is legal in the country, etc., it's something, ethically speaking, bad. From the perspective of the Islamic ethical tradition, this is a bad act. It's a sin. Because the one who gives life is the one who takes it, and that's God. But this is something, and what we are discussing is something else, that we stop, withhold, withdraw, etc. This is a different category when we speak about the moral judgment.
Yes. Okay, now I'm going to open up to the audience now. So if anybody wants to ask questions and they want to come on live, inshallah, if you raise your hands, inshallah, we'll put you on. Whilst you're doing that, I'm going to turn to Ahmed Al-Jabari, who's asking the question: I'm a clinician working in the ICU and I face end of life on a daily basis. What shall I do when I see a patient with multi-organ failure deteriorating and I find myself prolonging his suffering with these life-sustaining devices? I feel the only acceptable way dealing with this patient is to allow natural death to take place. Do you think this is appropriate? So this is a clinician asking a question that I'm in this situation where I see that this person may be suffering by us prolonging life-sustaining treatment rather than benefiting from this. So you can add in that term, it's futile, whatever. So let me put this to two people, and then inshallah we'll move on to the next question. So I'm going to first put it to Dr. Rami. Reflect on what he's saying and give your response. How would you feel in that situation? Or how do you feel
I think that
in that situation?
In medicine, I think we have very poor training in dealing with emotions. And 9 times out of 10, patients and families who come to ask even about fiqh resolutions or qararat or whatever it is are coming from an emotional place. And if a person or a family member is in an emotional whirlwind, good luck trying to engage that person cognitively or intellectually. And so first and foremost, we have to offer empathy. We have to center the patient. We have to talk about the patient as if they are there and how they have lived, because that's what the family member is needing in that particular situation. We know the maxim, الأمور بمقاصدها, that intention, that, actions are judged by their intentions, and centering it on your intention, at least for me as a palliative care clinician, what I do in relief of suffering and supporting patient and family members, that I do find room for, the withdrawal of life support treatments in certain cases. Absolutely.
Okay. And Sheikh Tariq, let me frame it a bit slightly different to you. So there's a dilemma here. The dilemma here now is, okay, life-saving treatment, not really benefiting the patient, but we're going to continuing life-saving treatment for the benefit of the family, because they want to continue. Is there something about darar to the person, in terms of harm to the person? And is there something in the Sharia maybe where we may even say from the Sharia perspective that it should be withdrawn? Is that something that exists?
First, look, if the patient have an opinion about this, if he's able to express his opinion and he refuses treatment, so with very little exceptions, we should follow his opinion. If he's comatose, if he cannot express his opinion for any reason, then we should rephrase the words you used, actually, because as I said before, life-saving is a benefit. We should not neglect this benefit. But we also look at the burdens of life-saving. Sometimes life-saving has a low success rate, and it has a high burden. It actually might deliver harm, like when you use the CPR in a hopeless trial, and you start to crack the bones of the patient, the rib bones, and you can cause also, as you said before, lowering the dignity of dying. All of these things can be put in consideration, but with taking in mind that we should differentiate between treatments. Not all treatments have fluctuating or low success rates. Sometimes we have to put saving life first. Sometimes we can do some equations and we can weigh things against others. And there is a very detailed, very profound view about this, but I think I will not be granted the time to explain it in
inshallah, maybe on the course. Okay, we got Ahmed Hamsawi. You want to come online and ask your question?
Well, thank you very much. Actually, I'm a staff nurse, at the same time father of palliative daughter under palliative care treatment, and I lost my dad after being on almost 8 months of.
I don't think we can hear you too well.
Maybe I share just some comments that what I found, what happened for doctors when it comes to the denial and resistance of some families from the order of DNR, that doctors are actually take very, let's say, very late time of engaging family about the reality of the condition of their loved one. The prognosis of the case, if it's getting deteriorated, family normally they don't get engaged, and they don't actually get engaged to look into what's going to happen in the future. So that's late engagement. It's I think the reason of why this reactions happen. I wonder if there is any comment about this issue.
I'm not catching all that. I don't know if any of the panelists have caught a lot of that. Maybe, yeah, Dr. Rami?
Yeah, I can comment, and I read his paragraph there in the Q&A.
Yeah, go ahead. Yeah,
you're absolutely right, Brother Ahmed. I don't think doctors do a great job, talking about prognosis or a diagnosis and what to be expected in the future. In fact, studies have shown that patients expect their doctors to bring that up, and studies have also shown that doctors do a poor job bringing it up because it's an uncomfortable situation, because the model of healthcare delivery is now, at least here in the States, depends on 15-20-minute visits with your doctor. And how can you discuss all that is around these decisions and prognosis in that short amount of time? So yes, we do need to be better at communicating. And as patients or as loved ones of patients, I want to empower you to ask those tough questions. Say, doctor, knowing you've known about my father, what can we expect in the future? Do you have any ideas about prognosis? So in my advanced care planning workshops to Muslims and people of other faiths or no faith, I often empower them to ask those tough questions to their doctors.
Okay, I'm going to go to Junaid. Junaid is asking a question, which is an interesting question. It's the way it's been framed. Palliative care should be provided concurrently with potentially curative treatments, not as a separate entity, i.e., curative and palliative separately, but rather they should be together. Remember that it's an approach that deals with life-threatening illness, as per the WHO definition. What's then to say that it can't be provided and then stopped should the patient be cured? So I think it's an interesting question, because what it really indicates to me anyway is that we're differentiating between curative and palliative, and we're separating them as separate entities altogether here. But that, I'm not sure that's what we're doing. So is this question a misunderstanding? Dr. Rami, I'm going to put it this to you because I think you're probably the best person to answer this from your profession. And
Junaid, you hit the nail right on the head. I was saying Junaid hit the nail right on the head there. The WHO actually put it out in '82, I believe, where there used to be two separate boxes of curative and palliative. But what they found instead is that over the course or the trajectory of a disease, one may be more weighted, right? The focus of care may be more on curative versus palliative, but they should be hand in hand. And palliative care is one that can be offered at any age and any stage of an illness. In fact, many outcomes, whether it's patient outcomes in terms of quality of life, or systems outcomes in terms of avoiding readmissions, unnecessary readmissions, or ICU stays, should happen at 3 months at least of following with a palliative care team. So it should be one that hopefully moves more upstream rather than just purely end of life.
Okay, there's a generic question here, and I think what I'll do is I'll put this to Dr. Ghali as our bioethicist, and the question is, I think it's supposed to be a transliteration of Urdu maybe, is euthanasia permissible? So I suppose we need to understand what euthanasia is.
Yes. As briefly, I already said,
Yeah.
if we may call the discussions that we have here passive euthanasia, and this is problematic according to both physicians and religious scholars, if we can call it like this. But this is something upon which there is disagreement, as we say, we have seen now, and I discussed the collective reasoning, the individual ijtihad, etc. But active euthanasia, giving someone an injection to intentionally terminate his or her life under any pretext, there is too much suffering or whatever, this is categorically forbidden according to all scholars I'm aware of. In the pre-modern time, in the modern time, there is no disagreement here. But the points we discuss, this is where you have space. I have seen different questions saying that I'm a physician. I see that there is no way of going further with treating every single treatment. I feel that this is just adding to the suffering of the patient. What should I do? From the discussions I have read, the first thing you have to discuss with your colleagues. It should be a group decision, not an individual decision. Maybe you are mistaken. Maybe there are ways to improve the situation and to avoid death through the people. If we have a group decision, then you need to discuss with the family or with the patient, if the patient is aware, so that they can be involved in this. And then you come to a conclusion and then you do it. Because there is, the question is that if we are physicians and we came to this conclusion and the family said we want to do it, and we did the DNR or whatever, are we again, there is no opinion, considered opinion in the Islamic tradition that would say this is possible? Yes, we have. There is. But are there families that can follow another opinion by this or that scholar, as we have here in Pakistan or whatever, and they want to follow this? Yes, there is a possibility. They can, even if it is a minority position. This is Islam and how it works. The main thing is that you in the hospital need to have a good discussion with the family once they are admitted. Don't wait till the critical moment comes, so that we can have mutual expectations with each other. Thank you.
Okay, just for the benefit of the audience, euthanasia, the pivotal point of euthanasia is its intended actions or commission or omission of actions. So, you know, when you're intending to take the life of somebody, that would be a sense of euthanasia. And you may do that because you feel that the patient is under a lot of burden towards the end of their life. So people would usually sort of look at it from that perspective. We've got Khalid Hamoud. Do you want to come online, inshallah? Khalid Hamoud.
Assalamu alaikum.
Wa alaikum salam.
Thank you to all the panelists. I'm a physician in the United States. I just had a quick question. I appreciate Dr. Rami mentioning the New Journal article, which I feel was very, very pertinent. But a lot of times for our Muslim patients, you know, that might not hold a lot of weight with them. Are there any, you know, fiqhi precedents that we can bring up, whether from the Sunnah, the Sirah of Prophet ﷺ, from the Quran or Ijma' or Qiyas, where we can give them these precedents to help ease their anxiety when approaching the topic of palliative care with them?
Without going into too much detail, Sheikh Tariq, if you can just give us a very brief insight, because I'm going to talk about a course very soon where a lot of this detail will be put forward to you, but inshallah. Yeah.
I needed to rephrase the question again, please. I didn't get it. Can you summarize the question again? Yeah.
So in essence, what he's asking is, towards the end of life, is there something that we can reflect on for patients that are from the Sharia, yani Quran and Sunnah, that we can actually put forward to them that would be of a comforting nature for them in those kind of situations?
Yeah, for sure. The scholars say that when one is approaching death, he should consider raja, thinking of Allah subhanahu wa ta'ala's forgiveness, and looking forward to this forgiveness. Also, one should talk about the nature of death, and that it doesn't necessarily mean a bad meaning. It has a good meaning in Islam. It has a beauties actually in Islam. Also, the rewards that the patient have when he's patient and he tolerates the suffering. for the sake of Allah. There are many principles and values in Islam with a lot of texts from the Quran and Sunnah that can support them. So if we use this, yes, I'm sure it will change the mood of the patient. And I think this is proved in the general context, the role of religion to improve the quality of life. I think it's proved already, and in Islam we have the proof of it from our texts.
Okay, shukran.
Can I add,
we have sorry, yeah.
Just
Dr.
a
Rami,
quick
yeah.
point.
Yeah.
Rasulullah sallallahu alayhi wa sallam, made a dua near the end of his life. Allahumma ani ala ghamarat al-maut, or Allahumma ani ala sakrat al-maut. Oh Allah, help me with the throes or the pangs of death. And so we know that from his seerah and his sunnah, he taught us all on how to live on all aspects of living, including the last days of life in this world. So there's a ton to learn from the seerah and the sunnah around this.
Okay, and like I said, I will be mentioning a course towards the end of our session, and inshallah on the course there's a whole 1 or 2 sessions just solely devoted to this topic. We got our respected Dr. Judy, mashallah, online. So Dr. Judy.
Jazakallah khair, Sheikh Rafaqat, Sheikh Dr. Rafaqat. It's a wonderful day to hear these eminent speakers here, my friends and brothers. MashaAllah, la quwwata illa billah. I just want, I have, I have given a lecture in 2018 about the end of life of Muslim patients in the United States. And I discussed 2 cases, wonderful cases in terms of how Islam can make difference at the end of life, how Islamic teachings and adab and theological, revisiting theological concepts with your patient can make a lot of change and can actually prepare the patient for the end of life. But I just want to say one thing. We have case right now, hot case, where the father, the child has Zellweger syndrome, with multiple organ failure, and there is no, it's a typical case for DNR and for withdrawal of life support, typical. But the father is a Muslim scholar. He holds a PhD holder from Islamic University in Medina. He's non-Saudi. So he raised the issue to the governor, then to higher level, to the, I think he reached the king or something. And the hospital was forced not to withdraw life support until there is a clear discussion. And there was an involvement of scholars and lawyers and many things about it. And we're still going on. So in the practice, it's not, it's not a black and white. As Dr. Ghali said, and I agree with him, we should be, we should prepare the family and the patient, if we can, from early stages, not to wait until the end, and then we can get in clash with the father or with the family or with the patient himself or herself. So preparing the patient from the beginning, or preparing the family from the beginning, is very important. I would like to conclude with one thing. One day I received a call from one of my students who was doing his fellowship in pediatric intensive in ICU in one of the Auckland hospital. The patient has a neurological deficiency syndrome, and he was at the end of the life on life support, which is, they are doing nothing to him actually. So he said, I want to call you and to put you on the mic, because the father of this patient is American from a Yemeni origin, and he is very good Muslim, and he wants to hear that he is not killing his boy with taking the decision to withdraw the life support. So I spent 20 minutes with the father, reading from the Fatawa of Ulama, mentioning the names of the scholars. When I mentioned the names, big names from all over the world, Muslim world, and I told him that in this case, they are not doing anything to they are not treating actually your child, but what they are going to do is to let the death, the natural death, take its pathway, because they are doing nothing, and eventually your child will be in a vegetative state, because they are not helping him. He is deteriorating very fast, and that's why when they just remove the life support, just minutes. My student told me that it was a few minutes, and the boy died. So sometimes it's about withdraw life support is like, we can quote the hadith from the Prophet ﷺ life and Abu Bakr at the end of his life. Sometimes you just leave the patient to die. You don't do anything. You don't administer the lethal drug, or you don't leave the patient while you are sure that you can do something. But if you are sure you are not doing anything to the patient, that's the point here. I understand that sometimes we are facing with emotional flood in ICU or in the room, in the family meeting room. We have to be careful not to go with the emotions. We have to be careful to explain everything to the family and to make sure they understand. And the decision is their decision. And as I said, this is in our case, in the hot case, the Muslim scholar is not Saudi, but the governor supported him because they think that the physician should do everything to the patient. The problem is that he was not prepared to this decision from the beginning.
Okay.
Thank you very much.
Dr. Judy, I think you've raised a very, very important point. And this is an area which is a very gray area. And I don't think it's been amply addressed. I'm going to put this to Dr. Sheikh Tariq, I think probably more so.
Yeah.
And the issue here is, and I'm going to phrase it like Dr. Judy mentioned it, but phrase it probably with a bit more clarity. So I know that the Qarar and a lot of these fiqh academies, they have addressed some of the issues about somebody who's brain dead. So somebody's brain dead, yes, you can now withdraw life support. What if you got somebody who has just neurological deficiency? Let's say somebody who has dementia. So an elderly person who has dementia. And there is some element of consciousness there. They're breathing and they could breathe on their own. But they are, their capacity has deteriorated considerably. So their understanding of their environment has depreciated quite considerably. And you don't have to give this as an answer, as yes or no, but just discuss it in your own sort of words. What kind of response would the Sharia, and when I talk about from the fuqaha and the ulama, what kind of response are we getting from them in cases like this, where, okay, the patient is not brain dead, but there's, serious compromise of the neurology of this person to that degree where they're considering, are we right now to withdraw life support? Sheikh Tariq?
Okay, let me say again that, can you hear me?
I can hear you.
Can you hear me, please?
Yeah.
Okay. I think my internet is going a little bit. Just give me a second, please.
Okay, we'll pass that on to Dr. Ghali first, and then inshallah we'll come back to you.
I'm trying to switch the network.
Okay.
I think it's good now, right? Isn't it?
Yeah, we can hear you. We can hear you.
We in answering such questions, and also in dealing with cases like the one, not resort to general principles. Resort to general principles because the Islamic the detailed system of judging things. This is a typical go to general principles like saying that we should not cause suffering. Yes, this is a principle, but how to implement it? We have detailed views about this in the fiqh. So I think regardless whether it's brain death or any other neurological state, if we need to lift burdens, if we try to minimize suffering and bring ease to the patient, can you hear me?
I think you're cutting out here and there, inshallah.
If we need to do all these good principles, bringing ease and lifting suffering and so on, we should follow a Shari way. We should follow a way that is allowed by Sharia. And to my knowledge, when you do a cause and there is an effect are related in a very clear way, you are doing a deliberate act. You are stopping ventilator, you are causing death. We cannot manipulate this. It's a fact. So that some scholars thought that brain death is not a real death. They didn't allow to do this. There are at least 4 scholars who prevent stopping ventilators for brain dead patients. So as I said before, and I keep repeating it, we should look for Shari exits. We should try to stop the things that are not giving a clear advantage to the patient in terms of saving life, not in terms of quality of life only. We can do palliative care, we can increase quality of life as much as we can, but we should not have a goal to hasten death. We should not have a goal and use these phrases like letting nature take its course. It's secular phrases. We should intervene as much as we can, but without breaking the rules of the Sharia. And Sharia itself protects the patient from doing harm to the patient. Most likely we have CPR. It's in many instances it's a failure, and there is no need to do it. Sometimes even the electric shocks are not working, and many other interventions like surgical. And as Dr. Rami pointed out, the study shows something that I already felt in my study. The attitude of tailoring the withholding of treatment in a Sharia way, it leads to similar results. And I asked many doctors, I try to put forward a criteria to withholding life-sustaining treatment, and I sent it to some doctors, like 50 doctors. It was a questionnaire. Actually, many of them thought that if we implement this, we will not have very different results. So we are just changing the concept, doing some manipulation in the way we DNR patient, if I can say, and then we are getting the principle of bringing ease to the surface instead of denying the preciousness of life, the intrinsic value of life. So I just keep repeating this. Sorry to do this, but this is what I think.
It's a very technical issue. So Sheikh Tariq is articulating it in a very succinct way. I'm going to put it now to Dr. Ghali, and I'm going to just add to this for the benefit of the audience. And I'm going to make this our one last question, inshallah, then we're going to move on to something else. So let me just talk about the discourse that's currently out there about quantitative elements of life and qualitative elements of life. Now, quantitative would in essence be, we know that a person only has a few days to live, or they have like a week to live. So that's the kind of situation that we're in with a particular person who's on life support. Qualitative is that the person can survive, without life support. But the question is what kind of life they will be living in, where they have serious neurological deficit. So in other words, they're in a vegetative state. In that kind of situation, we're looking at life support. So from the quantitative and the qualitative, differentiating between the two and looking at them from that particular perspective, do we have some kind of a perspective from the Sharia perspective of what you may have read around on differentiating between them two elements, or are they considered in the same light, like Sheikh Tariq has mentioned to some degree?
Thank you so much. I just want to support what Dr. Tariq is mentioning, that the moral world is very significant. So as a Muslim, I have a moral world, and this moral world has check boxes, which are things which are important, things which are less important, etc. And also, as a physician, I have a moral world. Even if I'm a Muslim, my profession makes me think in a certain way. As a religious scholar, I have a moral world as well. As a family or as patient, I have my own moral world. The issue is that when we are all in a situation or an ethical dilemma, we need to sit together and find a compromise and a solution. So as a son of my father is on the life support machine, all what I care about is that if my father dies, I don't feel guilty at the end. That I said to the physicians, told me this, we cannot do anything. I told them yes. After a year or 2 or 10 years, someone came to me and said, you were wrong. There were solutions. What kind of guilt I would have? The physician doesn't want to see his patient suffering, because this is not good. So we all have goodwill on the table. We all have goodwill. The question is how to negotiate with each other. That's why I say from the point of entry into the palliative care unit, we need to discuss. And I also agree with Dr. Tariq about using certain terminology can be quite confusing, like quality of life. Quality of life, a great part of my life, I've been living in the Netherlands. This is the country, the first country worldwide to legalize euthanasia. And we have this discussion about quality of life. You hear things like, look, I have been a bank director, and now I cannot even sometimes cannot even recognize my children, etc. This is not the life that I want to take, and I want to terminate this life. This argument will not work in the Islamic tradition, because you are not the one to take decision about terminating your own life. But if we mean by the quality of life that what the religious scholars mean about curable and incurable, ما يرجى برؤه ولا يرجى برؤه, these categorizations morally matter. So if there is something that we as physicians, based on immense records before, we believe this is incurable, we cannot do anything. The only thing we can do is that we palliate the disease. Okay, then we do it because it is incurable. This can mean at the end quality of life, but this is not the main issue. The issue is curable and incurable. So as I said, brain death, you will find dominant majority of the religious scholars, individual and collective ijtihad. If we have brain death case, we can stop life support machines. Even if we don't recognize brain death as this, yes, even if we don't recognize, because for instance, the Islamic Fiqh Academy in Mecca, they said brain death is not death, but you can stop the life support machine. Why? Because it's incurable, it's dying process, and the dying process is irreversible. It's like death. And those who said it is death, they said you cannot treat a dead person. So in all cases, they agree. I understand what Dr. Tariq mentioned, that there are religious scholars who disagree with that. I can understand that some physicians and some families may align with these individuals, but people need to know where is the majority, where is the minority, where do we stand? So at the level of brain death, you will find great support from the religious scholars and from almost all Muslim physicians saying that this can be done. There is no brain death. But there are other health conditions, generally speaking, about the body is not functioning properly. It's deteriorating now. We say here that there are opinions of both councils and individual religious scholars saying that it's possible, but under conditions. It's not like that. It's not because this is compromising quality of life and we do it so we can. It's not like that. There are conditions. One of these important conditions of these, the irreversibility of the health condition, and that this is irreversibility is judged by group, not by one person. That the patient gave consent or the family gave consent to this. I understand that there are some fatwas that say that the consent of the family doesn't count and the consent of the patient doesn't count. I totally disagree with this, but who am I? Am I just a person? But I would like to say, on the work floor in the hospital, if you try to do this, you will get a scandal in the hospital because people are quite emotional. In the Netherlands, if the patient signed a donor codicil, you can take the organs without asking the family. If you ask any physician in the Netherlands, they will say, we have to ask the family in practice, because you don't, how come you are taking the organs of my father and I don't agree and I will let you take it? So it will be a problem, and you want to keep the reputation of your hospital intact. So there are conditions. Once these conditions are met, the question is this can be acceptable within the Islamic tradition according to some scholars and some councils? Yes, it can. Is it possible that there are physicians and families who would disagree with it, even if we have a majority position? Yes. Can we say to these people, you are ignorant, you don't know your religion? And we cannot do that because this is a considered opinion in there. All what we can do is negotiating with them.
Okay, inshallah. And that's a very good way to end, inshallah, today's webinar. First and foremost, I'd like to thank all our panelists. Alhamdulillah, shukran jazeelan. Barakallah for all your time that you've taken out, inshallah, and some very fruitful discussions there. I apologize sincerely to our audience. There's a lot of really good questions out there, that we've not had the opportunity to talk about. But inshallah, no fear. I just want to just put forward to you the course that we have on Islam, end of life, and palliative care. So this course will, in essence, go into quite a lot of depth. So some of the things that we talked about are just tip of the iceberg, but there is a lot of depth in this kind of discourse. So this course is primarily for clinicians, it's for any kind of person attached to healthcare, especially end of life and palliative care. It's for chaplains, it's for academics, bioethicists. It's also for Muslim patients and relatives who want to go into a lot of more detail on some of these really, really important discussions. Historically, we've had people on this course who have been clinicians, chaplains, we've had ethicists, and we've also had people from the health policy departments from all over the world, from countries all over the world, and we've had a really good response. So inshallah, this course, hopefully we're expecting a similar kind of response. So it just gives you a bit of an idea of some of our speakers, but we'll have others also who will be joining us on. There will be a discussion about palliative care, the terminologies that we talked about today, also looking at what does it mean by illness in Islam, what does that actually entail. So this goes back to the qualitative element of what is quality of life from an Islamic perspective. Then there's something about Islamic end of life care. What is our understanding of end of life care from a more Sharia sort of perspective. Then end of life counseling. So this is more about the discussion that was earlier on. How do we address issues of comfort for the family in these situations? So there'll be some case studies related to that. There'll be something about a much more in-depth discussion about the Islamic ethics of fiqh of withholding treatment, such as DNR, do not resuscitate order, CPR, and various other withholding treatment like artificial nutrition and hydration, for example. And then there'll be something on withdrawing treatment, such as life support and other sort of life supporting sort of treatments other than mechanical ventilation. So there'll be quite a lot of discussion about that. And then finally, what does it mean by palliative care from an Islamic perspective? How would that address some of the discourse regarding palliative care? For example, treatments, certain drugs that are used, morphine-based drugs. Also, one thing that we didn't talk about today, which is about the idea of double effect. What does that actually mean from an Islamic perspective? Then a really important thing that we sort of finished in our discussion about diagnosing death rituals and donating organs. So a depth discussion in terms of how that relates to the whole bigger discourse. And then finally, grief and bereavement. How do we address bereavement? Somebody's now passed away. How do we address those kind of issues? And then more sort of technical issues around wasiya and wiratha, Islamic will and wasiya and so forth. And then finally, open Q&A on the future developments in palliative care for Muslims, how we should go forward and look at how an Islamic framework would work around palliative care. So inshallah, this course is open for people to register. So hopefully those of you who feel that a lot of the questions clearly have not still been answered, but in the little time that we've covered, alhamdulillah, we've covered a lot of very, very important discussions where there's a lot more complexity that underlies them all. And inshallah, this course will deal with this. It's a very unique course. It's the only course at the moment out there on an online basis that really does deal with this from a truly Islamic perspective. And we have, alhamdulillah, like our panelists, we have immense international experts who will be addressing a lot of these issues and bringing them to you, inshallah. And they will have plenty of opportunity for you to ask questions during those sessions also. So finally, I want to again thank our panelists for being excellent. Alhamdulillah, we've learned so much from them. And inshallah, we will hear more from them on our courses. There are our instructors on this course as well. And inshallah, we'll have more of a discourse in some of those pertinent areas that you people have been asking in the Q&A. So jazakumullah khair and shukran jazeelan and jazakallah khair for all of you for attending. And inshallah, we'll hope to see you soon. Assalamu alaikum wa rahmatullahi wa barakatuh.